pretty hard to tell because we didn't have good statistics in those days. But we know that there was, in 1918, a major impact on how serious this flu was, particularly in young people. And part of that is because young people have a stronger immune response, and what was happening is the influenza got into their lungs, the immune response was so strong that it created pneumonia. And the majority of people were dying pneumonia. And we didn't have anything to cure pneumonia like we do today.
Right,
so you
because
can get
didn't have
antibiotics.
Right. Really weren't developed at that point. Yeah.
So, you know, when people get hospitalized for this, it's usually because they have pneumonia and they get that chest congestion that's caused in part by not only the virus, but by their immune response to the virus. And therefore they can get treated then for that symptom of chest congestion.
But that also kind of points to the reason why people with respiratory issues such as asthma or emphysema really need to be thinking about protecting themselves during the course of the flu season.
Because their lungs aren't as strong.
Right. I've been seeing people wearing masks, just kind of anecdotally seeing them like in airports. And I was recently at a hospital. A lot of people were wearing, you know, there was lots of masks available. Does that do anything?
Well, it won't prevent you from getting it, but, and there's some belief that it may not even prevent you from spreading it. But you'll go to a lot of places where the clinics are saying, if you have cough and respiratory illness, please put a mask on.
Just because you're not spreading
it in the waiting room.
Within the environment.
Right, in the waiting room. With some people who are essentially working right in people with a respiratory virus, then they wear a properly fitted mask, what's called an N95. Our staff, for example, when they're working with people with tuberculosis, are all masked with N95s. But we're not recommending that people wear masks to prevent it. Now, you remember in Mexico, they were passing out masks, and it's a feel-good, get you a better seat on the bus sometimes. You know, if you have a mask on, no one wants to sit next to you. But at this stage of the game, we're not recommending masks. The clinics, I think, have some sense that people will feel more comfortable sitting in a waiting room waiting to see the doctor if the people with coughs have a mask on.
And I think there's probably a sort of question of how you're managing people's anxiety as well in a situation like that. You're there, you're feeling sick in the first place, and you don't want to be thinking about the person down the couch from you who's coughing
away. You know, one of the issues you'll start seeing is much more hand sanitizers. And I know a lot of businesses are putting them in and encouraging people to use the hand sanitizers, particularly if you're going to be working with somebody where you're shaking hands or touching.
And that's actually probably the best sort of seasonal recommendation you can have for somebody, you know, it's not for home remedies like having a bowl of chicken soup, but like just to stay healthy is to wash your hands on a regular basis.
That's correct. Wash your hands, use a hand sanitizer. You probably will get fewer colds that way, because most of our colds get passed from, you know, the ill person to their hand, to your face. So the more frequently that you're washing your hands and or using hand sanitizer, an alcohol-based hand sanitizer, and use it well, the less likely you are to pick up a virus from other people.
And it's not an antibacterial soap, right? Because really what you're talking about is trying to get the virus off your hands.
That's correct.
And it's like the physical, it's the physical activity of trying to shed the virus rather than killing it, because you can't really kill the virus.
That's correct.
So I guess let me kind of take one sort of step up here as a sort of a public health information specialist. How complicated is your job becoming to communicate this to the population? I mean, is this, as you're thinking about sort of, you know, future years of this kind of work, is this kind of the new normal where we have to be doing this kind of public health education?
Well, it would be interesting to see if this virus burns out. Normally what happens with the seasonal virus, it burns out at the end of the season, and we have to be prepared for a new one.
Right, so it's like you're gearing up every year for
We don't know whether H1N1 is going to be around here just for a season. I mean, it started in the spring, it's now the fall. Will we see it next spring? Will it still be here a year from now? One of the reasons they're producing so much vaccine is to account for the fact that this may not be something that just disappears at the end of the season. So we have to be concerned about that. We have to be concerned about the fact that our workforce could get sick and what happens if a lot of our workforce is gone and how we manage that. We've been working very hard with our workforce to assure that they will come to work, but not come to work if they're sick.
And so you're encouraging telecommuting, flexible schedules, and people have the ability to be able to maybe work from home if they have to take care of their kids. And the like, is that actually, that actually helps public health perspective as well.
It does.
As maintaining productivity in a workforce.
But it doesn't help a place like a large grocery store or a large chain store that depends upon having people in the cashiers and putting stock out and things like that. They can't telecommute. So there's some industries that are going to be more impacted. Hospitals are going to be more impacted if a lot of their staff is off ill.
And I think the thing with hospitals obviously would be then to be a larger caseload that occurs in the course of a pandemic as well. So is there regional cooperation that's happening amongst the hospitals that are sort of thinking about emergency response? And
we have a program set up where all the hospitals in the metropolitan region work together on this. They, daily we know what beds are available, what type of beds are available. Do we need ICU? Do we need ventilators? How many ventilators? There's not a lot of them. And usually when someone's on one, you don't take them off and give it to somebody else. So that is a problem, that we have a shortage of ventilators. But the issue becomes one with the fact that we have plans for ability to triage people so they don't go to the emergency rooms, that they have a place where they can go and get information, that they can have a telephone or they can call their health plan and get information about what they should do, and that you don't, as the first thing, because somebody has a temperature of 100, jump in the car and drive to the emergency room. We think people need to talk to their physician. If they don't have a physician, they need to call a community clinic and get connected where they can get some advice as to what they should do. Some clinics may say, well, your child has asthma, yes, please come in. Others may say, well, the temperature is 101 and it seems like it's typical. Monitor him and see if it gets worse, then call us. If not, do this. There are also antivirals that seem to be effective with H1N1 if taken within 48 hours. And that's the key to it. You've got to take them early. They don't have a whole lot of impact afterwards. So people who are have children with asthma might want to talk to their doctor about getting a script for antivirals before the child gets sick. So they have that in hand in case the child gets sick, then they can give them the antivirals immediately.
We have about a minute and a half left here, Rob. So let's just kind of recap for people what they should be thinking about here this fall. One, there's 2 flu seasons.
Right.
And if you are susceptible for the normal flu, you should be getting your flu shot as per normal, not to be confused with the H1N1 flu shot.
Correct.
And then there's a separate group of people who should be contacting either their doctor or clinics regarding an H1N1 shot if they're vulnerable.
That's correct.
Populations. And those populations, again, are?
Well, we're talking about pregnant women, which are a very important population because they tend to have lower immunities. We're talking about families with children less than 6 months of age. We're talking about kids 6 months of age to 24, and people 24 to 45 who have some other condition that might exacerbate with the flu. And then obviously healthcare workers and emergency service people. And
people should take the normal precautions that they should anyway during the course of a cold or flu season in terms of sanitation, cleanliness, and making sure that they're not spreading a virus around. And if you're sick, you should stay home.
That's right.
It's actually probably one of the key recommendations. And then we want to make sure we give people the website again where they can get more information about what's going on in Ramsey County, which is your website over at Ramsey County Public Health. And we've got that for people on the screen right now. It's www.co.ramsey.mn.us/PH. I bet you if you Google Ramsey County Public Health, it will come up as well. But we've got that for people as an updated resource that'll be all throughout the course of the cold season, so people know about resources and what they can be doing to protect themselves and their community. That's correct. Appreciate you taking the time here today, Rob, and for talking to our viewers about what they can be doing this year during the course of the flu season. And we won't shake hands. Indeed. Don't take it personally. Rob Fulton is the Director of Ramsey County Public Health. Thank you for joining us. And for everyone here at SPNN, I'm Mike Wassenaar. Thanks again for watching this edition of the St. Paul Forum.